Hey guys, on this episode of the Regenerative Edge, I sit down with Dr. Cornejo down in San Antonio, Texas, of Ace Plastic Surgery, as he discusses his techniques that he's using for his procedures like retraction and also another product that he has called Age Jet. Please enjoy the show, guys. And remember, as always, this is not intended for medical advice at all. This is simply perspective from one of the physicians that are using the many products that Revive Regenerative has. All right, guys, I'm here with Dr. Cornejo from Ace Plastic Surgery down in Texas, and I've been so excited to really get on this podcast with Dr. Cornejo because he's really such an influence, specifically down in Southern Texas, with some of the techniques that he's using and some of the procedures that he's doing when it comes to skin tightening, as well as liposuction and some other things as well. But he also is on the forefront of regenerative medicine, for a long time now, as he's kind of started his own practice here over the past year. And it's just really excited to have him on the show. So, Dr. Cornejo, welcome to the show.
Thank you. Thank you, Chris. Appreciate the opportunity to be here and share some amazing information. So yeah, man, thank you. Thank you for having me on the podcast. I really appreciate it.
Awesome. So, your practice, Ace Plastic Surgery, right? Give us the rundown of how you started your practice, and you can go even further back and just talk about your story and kind of how you got into medicine and how you got into this great specialty that you do.
Absolutely, man. Well, Ace Plastic Surgery, we are brand new. We opened our doors to the public October 28th of last year. So we've been around for 7 months. But I've been a plastic surgeon for 9 years. So I'm going into my 9th year of practice as a board certified plastic surgeon. I've spent 9 years here in San Antonio in the area, so South Texas. And like you mentioned in the introduction, most of my patients come from Texas, South Texas, and I have a huge Hispanic following, not only in Texas but in the United States. And so we open. I just basically decided to go solo and open my own practice. I've been, like I said, I've been around for 9 years. For the first 5 years of my career as a plastic surgeon, I did 95% reconstructive surgery from head to toe. When I graduated from my training, I went to Duke University, by the way. I took a job in the Baptist healthcare system, and I was the only plastic surgeon in the entire healthcare system in San Antonio and in South Texas. And so I got busy really, really fast. I did 609 cases my second year in practice. So I was really busy doing tons of reconstructive surgery. And I loved it. But it got to a point where after 5 years, I wanted to just expand my practice and just focus more on the cosmetic aspect of plastic surgery. And so I had the opportunity to join a practice, a very busy practice here in San Antonio. And I stayed in the hospital for a year, but I got so busy doing cosmetic surgery that I had to leave the hospital. And for the last 4 years, I've been focused 100% on cosmetic surgery. That being said, I do a lot of my practice has evolved drastically over the years. Now, 50% of my practice is facial rejuvenation, and 50% of my practice is body, any type of body procedures. I do a lot of things, really. There's very few things I don't do. And so I've enjoyed, this has been wonderful years. Like I said, I've been in San Antonio, and the community here is just amazing. The patients. I'm very happy and very fortunate to be in South Texas. But going further back, I got, I, you know, I come from a family of doctors. My great grandfather was a doctor. It skipped my grandmother. My parents are doctors, and I'm a doctor too. So I really think that, in a nutshell, I was just it was meant to be, for me. I got the good genes. And so I went to, I'm originally from Mexico, and I went to the same medical school as my parents. And so I graduated back in 2006. And then I moved to the United States because I was able to do some rotations in different hospitals when I was a student. And I realized that this is the place to be, where I believe we practice the best medicine in the world. Not saying that, I mean, there's good medicine throughout the globe, but for training purposes, access to technology, I mean, I was just amazed with the just with the training here in the US. So I made the decision to come in here. It took me 2 years to revalidate my diploma, and then I got into general surgery residency. I trained at the Health Science Center here in San Antonio, so University of Texas, for my general surgery training. I spent time doing research, and interestingly enough, with uh, some sort of regenerative type of research. And so I fell in love with plastic surgery then. And then I finished my training, and then I did plastic surgery at Duke University for 3 years. And after 17 years of training, I said, you know what? I think I'm done. Let me start doing what I want to do and what I trained to do. And so I was very lucky to end up here in San Antonio. And so it's just it's been definitely a journey. Um, but one more thing I like to say is that my I was very lucky to have a very good friend of mine in medical school, who was really involved with Operation Smile. Who I don't know, you heard of them? They're all over the world. It's a nonprofit for cleft lip and cleft palate. So my friend got me involved when I was in med school. I was able to participate in one of the first missions in Mexico, and I met amazing plastic surgeons, amazing people, and that's where truly my inspiration comes from. Um, I remember the first mission was in Guadalajara, and we had people like Dr. McGee, who's the founder, Dr. Joseph Sheen, who at the time was the chief of craniofacial surgery at Yale. We had Dr. Bermudez, who is a famous plastic surgeon in Colombia. Dr. Green, who at that time was doing the Extreme Makeover show in Beverly Hills back then. And I met these guys in a mission setting. And that was, I mean, it's still today, I think cleft lip and cleft palate is one of the most rewarding surgeries that you can ever do for a baby. And I fell in love with just, what seeing myself, what you can do with your hands and how you can help these people. But at the same time, I mean, these guys were to me like just, I mean, they were like amazing people. I was like, when I grow up, I want to be like them. And so that's how it all started, and
Yeah.
and then I was able to go to several missions. I went to several missions in Mexico, in Bolivia. We actually went to the Philippines, and then I got into surgery. And so I was already I already knew I wanted to be a plastic surgeon. And so it was great that when I was doing my surgery residency, I spent time with the plastic surgeons, and that's where I really said,
Yeah.
this is what I
So
need to do.
you actually got into plastic surgery, thinking about, medical conditions essentially that you could cure, or you could solve, to make people look and essentially feel great about themselves. And then fast forward to now, I always talk about, purpose, and, things happen for a reason. And you talked about your friend, and similar, Dr. Abtahi on the show a few last week. He talked about somebody that really helped him out along the way. But it's always cool to hear people's story and hear them talk about, hey, I had somebody that I really admired, or somebody that really helped me along the way get to where I'm at. And your story is quite unique because you come from a family of doctors, right? And it's almost like, professional athletes, right? Somebody that's played, soccer or football, as they call it in South America.
Yeah.
They have a better chance of playing soccer or football professionally. I have a son, actually. I played professional ice hockey, and my
Okay.
son is now playing hockey. So I'm like, fingers crossed, but he'll do a lot better than I did, I'm sure. Um, so tell us a little bit about ACE, plastic surgery, and you founded it, and talk about what you guys are offering in there, and how you're kind of on the
Absolutely.
forefront of medicine in your particular area.
Absolutely. One thing that you mentioned is it's very important. My plastic surgery is so broad. I want to call it plastic and reconstructive surgery, and I've done all kinds of both cosmetic and reconstructive surgery. But at the end of the day, what we do is helping people. That is this. That's what I do. That's what gives me uh, you know, gratification, joy. You do something for somebody and you're helping them. It is different, different conditions, but at the end of the day, it is such a beautiful profession because you're able to help people. And one thing I realized is that people come to see me because they need help. It doesn't matter what type of help, they need help. And me being able to help them is really, that's the most important thing. And so I always put my patients first. Now, ace plastic surgery, um, it's been a process. And everybody has their time. A lot of people ask me, why didn't you open your practice before? You've been on practice for 9 years. And the answer is, I if I hadn't had the 8 years of experience and the knowledge and the relationships that I built, I would not have been able to open my practice and just go solo. And so um, you know, and the main thing is that working in a hospital setting, working in a group where you're not driving the ship, you're not the leader of really of the group. Then I realized that in order to really take the direction that I wanted to take, then I just had to take the wheel. And that has been key for our practice. And ace plastic surgery is we offer all kinds of cosmetic surgery from the face and the body. Like I said, I do a lot of facial rejuvenation, facelifts, neck lifts, eyelids. I do noses and also mummy makeovers, right? Breast augmentations, tummy tucks, liposuctions. Today I literally just had a 360 lipo. I use retraction, by the way, and a breast augmentation. So it's been a great day. Um, and so another another thing that I think makes us a little different is that we have a really good team, and like everything in life, things have fallen into place. I'm a big believer that um, whenever you're doing the right thing and whenever you're going in the right path, things just align. And that's what happened with my practice. We have several people on our staff. Carla, who's my wife, and she's running the front desk. She's a dietitian, so she's running the weight loss program, and she knows a lot about skincare. And because I'm doing a lot of facial rejuvenation, we've created a really nice relationship there, because I wasn't as aware of all these amazing medical grade skin products. But anyways, we have a nurse injector who's a nurse practitioner, so very qualified nurse injector who I've known for 8 years because she's the wife of one of my very good friends who is a vascular surgeon. We used to do cases together all the time, and so she decided to take a change in directions. And coincidentally, I was opening the practice, and so now we have a nurse injector. She does all kinds of injectables, Sculptra, biostimulators, and different things. We also have our practice manager, who's Cecilia, who I've known since I came to town. And so her background is really interesting and amazing. Her background is in nonprofits. So she used to work for, actually, it's called Any Baby Can, where, they have a really nice purpose. And so she wanted to change a little bit of paths of her career. And that was the first person I thought of, like, I want you to be part of the team as a practice manager. And so luckily, I got her, or we got her. And then we have an esthetician as well, who her name is Lorena. I met her since day one. I came to San Antonio as well, because she used to work for Baptist. And she is the sweetest person. She knows so much about skincare. And so, and then last but not least, we had an amazing medical assistant who, her name is Christina, and she wants to be a doctor. She's going to go to med school next year. And, funny enough, like, we were all, okay, Lorena, Cecilia, Carla, and I, in the same office 9 years ago.
Wow.
And then life took its course, and now we're back. So when people come to our practice, they're like, "Oh my God, you guys look like a family. Like, what's going on?" I'm
Right.
like, we just, I
I,
mean,
I was actually going to say that. I said that, it's reuniting the family. It's funny
mhm,
because I think about a lot of different plastic surgeons like started their own business because I think sometimes people, they don't realize that, yeah, there's a side of being a plastic surgeon, which is I have to look, or I have to make people look great. I have to make them feel good about themselves. And I have to be very careful doing that. But then on the complete opposite side is the business side, right? And I think about Revive and kind of our company, and it's all people that have worked together in some cases for 30 plus years, right? Whether that's, somebody that's in FDA regulatory or somebody that's in, marketing or service or whatnot. These are people that have worked together for 15, 20 years at different companies, and everybody's kind of come back to form this Revive regenerative company, which is awesome. So it's really cool, especially a guy like yourself that, has been through not necessarily being the guy, like you said, at the wheel, but now has a chance to take the wheel, right? And you're kind of going and picking people that you think that A, you mesh well with, but B, that are people that you really believe and trust in making great decisions like yourself. And in business, it's more important than ever, right? Because it's one thing to be a great plastic surgeon, and quite frankly, I watch a lot of plastic surgeons fail because they don't know the business side of it, right? And that's what Revive is here to kind of help with on the product side, at least. But at the end of the day, you have to make good decisions and strong decisions as a plastic surgeon to align yourself with people that you believe are going to be your voice when you're not in the room, right? And that's the hardest
absolutely.
part about being a plastic, I think, personally. So
Absolutely, man. And like, yeah, like you said, you guys been around for such a long time. It just came together, but it's not
yeah.
like you guys opened overnight and now, like, oh, we're here,
Yeah.
because the market is it's saturated, right?
Yeah.
And so, and at the end of the day, like you say, there's so many plastic surgeons, so many practices around the United States, even here in San Antonio, and we all do the same. We all offer the same products. And if you go to a website, we're all the greatest of the greatest, right? But at the end of the day, what makes a difference is the people that you have in your office, the people that you surrounded every day. So there's quality of people, and that I think that's what makes us different.
Yeah.
Every time people come into our office, it's an experience where, like, everybody is we're on the same page. We're growing together. That's the other thing too, that we're all new. This is my first practice that I run by myself, and everybody's now kind of like everybody's starting from the ground. Nobody has like, oh, I've been a practice manager for 10 years, or I've
Yeah.
been doing this for so long. And so, that's great. But it also takes time to well, if you had talked to me 9 years ago, I wouldn't been able to really tell you what's good, what's not, or what works. And
Right.
so I'm personally very happy that I came across you guys because it has made a difference in my practice for sure.
Yeah, and that means a lot. And so that's a great segue into sort of the next segment about the technology that you use and what makes you so successful, right? And for myself, one of the most important things for me as we entered the North American market was to bring technologies that differentiated themselves. Like you said, there's, hundreds and thousands, if not millions of practices out there at this point, and the market's very saturated. So what differentiates everybody, right? And so when Revive Regenerative entered the US market, for me, I was tasked with the role of going and finding what I believe were the best products in the world, right? Whether that was in Korea or whether that was in Europe or whether that was in South America. And I came across two products specifically in South America, one of which you have, the other one I hope you get very, very soon. One is obviously retraction, and the other one is emulsify, right? And knowing what I know and being in this space for as long as I have, and obviously being around a lot of these products, what I quickly realized was that emulsify and retraction were the two most popular devices in South America right now. I mean, there were, I think, 400 units sold last year, right? And they're going to double that this year, because of the technology advancements, right? And I've had Dr. BBL on the podcast, obviously Dr. Abtahi and others that have had different products like Renuvion, Smart Lipo, other products, laser lipolysis products, Quantum, Body Tight by InMode, and they all say the same thing. You're talking about products that are really like the iPhone 11 versus retraction, which is the iPhone 27, right? And for me, bringing retraction into the US was a no-brainer because the impedance monitoring is incredible. B, the chance of having user error is next to none, with the efficiency and the safety of the device. And then C, the results were just so much better in such a shorter amount of time, right? You're talking a procedure that with something like Body Tight or, Renuvion or something else would particularly take you 45 minutes to an hour and a half versus in some cases retraction taking 15 minutes. And the first time I saw retraction, Dr. Cornejo, I was mind blown, right? That, you had this product that could do this. So let's talk. And you have two of our products. You have the retraction, you have our Age Jet, which is another great product, plasma device. But let's dive into retraction because that's something that you're using, almost as frequent, or you're using as frequent as possible. But talk about how much of a game changer it's been in your practice, and also talk about how much further advanced it is than other products that are out there.
Well, so I'm loving it absolutely. And I for the last for the past 3 years, I've used a lot of energy devices, but mainly Renuvium. I was in a practice where we were probably the highest users of Renuvium in Texas, and so I'm very familiar with it. And so there's no question that when you're doing cosmetic surgery, when you're doing liposculpting, when you're getting that niche of plastic surgery, you absolutely need an energy device. And same thing, I was using Vaser a lot, and so I loved it. But like anything else, I'd use it long enough to see the downsides of certain technologies, the potential issues that you can find. And when you're talking about energy devices, it is very important because I've seen bad complications happening. You can burn people, and that's something that you have to avoid at all costs. We're here to help people look and feel better. We're not here to you know create more problems. And so when I came across Revive, it was reassuring to me that it's been around for a while. and especially in Latin America. And the people that in the US that are using it, I know several of them. I mean, we're such a small community, but Andre Marshall, Beverly Hills, we trained together at Duke. Lena, I want to say her Navarro. I forgot his last name, but she's in Colombia, and we actually worked together in the Philippines. When I with Operation Smile, and so when I saw those faces, I was like, you know what? I mean, you guys are doing a good job trying to bring new leaders into into this technology. Now, what to me has been a game changer, and I'll tell you, um, especially for my facial practice, facial rejuvenation. One of the procedures I've done that is like the starter is like, when people are concerned about their double chin, or they have fullness here. I've done chin lipo for many, many years. And I was always a little disappointed, to be honest. I was like, okay, well, I'm doing chin liposuction. I'm looking at all this social media where, like, you do this procedure and then you look amazing, immediately. And I was a little hesitant to believe, like, okay, well, that was the case. But to me, has been a game changer, because that was the first thing where I did chin liposuction, and then I always treat the area with retraction, and I am amazed with the results. I mean, it's just, I mean, I can tell you it's a game changer, absolutely. And that's just one area, right? I haven't used it. I use it on the face, but I haven't used it as a. I use it as an adjunct. I know. It's very versatile. That's another thing that I really like, and you have a lot of potential. But the other thing I always do, I use it with my face and neck lifts, because I treat the area, because it's radio frequency. It delivers a very controlled uh, and amount of energy on the deeper layers, and I really see the immediate result. And when they come back at 3 months, they still looks good. And so one of the main issues with my neck rejuvenation is that you see skin laxity when they come back a few months later. So that has helped me a lot. Now, any time I do liposuction, okay, it doesn't matter if it's the arms, the body, I use it 80-90% of the times, because in my opinion, or in my experience, if you're going to do liposuction, you have to address the excess skin that you're going to have. The results are not the same. And so in the few 3 months that I've been using it, I it's such a friendly technology. Like you said, it's very safe, and I like that. Okay, it takes, as far as the timing that it takes to do a treatment. You have to spend some time. It takes a little, it takes a little longer. But when I spoke to Dr. Carlos Telles from Colombia, literally he told me, look, don't worry about the time that it takes. Look at the results. Patients are going to come to you, and they're going to pay you an extra hour of anesthesia, because, what they want is those results. And so, from the get go, I was like, you know what? I'm not going to worry about if it takes me 30 more minutes or an hour more. If it's more, I want more hour anesthesia. I'm focusing on the quality,
Right.
on the results. And so far, I had a very good experience, man, to be
Yeah,
honest.
that's awesome. Yeah, and coincidingly, the emulsify device, you brought up Vaser, and our emulsification device called Emulsify. It really truly is the next wave of liposuction. As Vaser, they don't have titanium cannulas like we have, right? And they don't have the temperature monitoring that we have. And so, one of the things that's super important for us is being able to um have the efficient product as well, right? And so again, user safety, combining emulsify with retraction is unbelievable. I just wanted to give a shout out to, we have a lot of physicians that are using emulsify and retraction kind of back to back. And it is like you said, retraction, you want to spend time and make sure that your results are great. But something like emulsify, it's taking, 30, 45 minutes off of some procedures just because of the energy that's being distributed versus some of the other products. So that's great. I love to hear that. For us, everything was about bringing game changing technology and obviously game changing biologics, which we'll get into the state of regenerative medicine in the next segment here. But before we leave the technology part of this, talk a little bit about Age Jet. Age Jet's a product that has been around for quite some time. It's one that many physicians say is the best plasma device that's out there for what it does. And it's a great alternative to a lot of these CO2 platforms that sometimes are thought to be a little bit more invasive and take a little bit more time for healing. But your perspective on Age Jet, your perspective on how it's changed your practice.
Yes, absolutely. And let me just add one more thing, Chris.
Yeah,
I've used Vaser for many, many years, and you're right. I mean, that probe heats up so much that it burns your hand when you grab it. If you're close to the skin, I mean, you can poke through it. And so, I mean, when I used emulsified, when I was able to try it, I
yeah.
absolutely loved it. And for
Yeah,
me,
it's
it's
it,
a
it
matter.
it is remarkable that and that was a big thing for us, when we were looking at different products. Is there were some other products out there, that were similar to Vaser, but still had either a problem with safety or b it still was painful. There wasn't it wasn't sort of that buttery feel to it, and it took time. And one of the plastic surgeons, a very famous plastic surgeon in Washington D.C., who now has Emulsify, Dr. Ron Perlman, he said to me, he said, "Oh my gosh, Chris," he said, "any plastic surgeon that doesn't have Emulsify right now is wasting time and wasting money, right?" And I got to be honest, the more I think about it, what you said, it's really safety, right? Dr. Otahi tells a story about how he was in med school, and somebody was using Vaser or a similar product to it and handed him the probe, and he went and grabbed the probe, but the guy had his foot on the pedal still. And the story goes that he had a hole pretty much through his gloves and a scar on it, or a really bad burn on his hand that lasted a few weeks. And so with emulsify, you can't do that because the energy is distributed out of the tip. And so that's another big thing. Obviously, time, efficacy, and safety of the. I'm glad that you brought that up, though.
Absolutely, man.
Um,
And
so
to me, it's a matter of time. It's just that I started very lean, very conservative. Believe it or not, my practice. So I was like, let me. It really, I really put a very good thought on it, and so it's a matter of time, to be honest, because we're on. I almost feel like our first year, we're doing so well
right.
that there's we're gonna grow, and I will acquire emulsify and some other technologies,
Yeah, we'll
but
get.
like I
Don't
said, I
worry,
think
we'll
I
get you
need to
taken
start.
care of over here.
Yes,
We'll
no,
get you
thank you.
taken care
But
of.
going back to the H jet
Yeah,
nitrogen plasma, again, it's one of those things where, like, when Nathan and Manny showed up to my office, it was just like perfect timing, because, like I said, my practice has turned into facial rejuvenation, and H was the thing that I was missing in order to be able to offer a comprehensive plan to rejuvenate people's faces. And why is this? Because I explain to my patients in like the best way I can explain you. The face is your skin, is your wrinkles, your volume, and your structures. Okay. But the first thing that people see is your skin. And so you can have a beautiful facelift and you can look amazing. But if your skin sucks, guess what? The result is not going to be as good. And so lasers, I've used, like many other plastic surgeons, I've used CO2 lasers. I've used other lasers in the past, but I really can't just speak about CO2 because that's what we had before. And absolutely good outcomes, yes. But one of the problems, okay, that we see here in Texas and with my patient population is that we are Hispanics, we're Latinos, we're a Fitzpatrick 3, sometimes even 4s. And so that's a big limitation for CO2 lasers. So the first thing I said, look, I'm not going to get into it because I'm not going to use it as much. And so when I found out about Age-Jet, it was the perfect uh, like meeting in the middle ground where I'm able to use it in a wide variety of skin types. I'm able to dial it up, dial it down. So um, again, you don't have to have a full facial resurfacing to use it. You can use it in lower settings and still get a benefit for your skin. And so we've been using it a lot. I use it on almost all my facial rejuvenation cases. I use it in all my blepharoplasty, so eyelid surgeries. I always use it around the eyes, and again, I had really good outcomes. So, and the other thing I really like about HJet is that it's non-ablative, it's not a laser. You don't need to get expensive certifications, and then an adequately trained staff can do it. So very versatile for a plastic surgery practice, especially people that are doing face rejuvenation, because that's something that you can easily get into your surgery plan. The one thing I'll tell you is that you still have to be careful with darker skins. Fitzpatrick 3s and 4s. You still have to consider, doing some pre-treatment to avoid, uh, post-inflammatory hyperpigmentation. That's the one thing I kind of like. I got excited. I was using it a lot, and then I was like, you know what? Yes, people that are prone to pigmentation problems, you have to be careful. But again, it's so it's been again a game changer in my practice. uh I'm gonna and again, you can use it for the face, you can use it for the hands, and you can use it for vaginal rejuvenation as well. I'm doing my first case in the next few weeks, and so again, it's so versatile. And so that's a thing that I really like about it. And also the cost of the probes and the things that you need to use the device on a daily basis is
Right.
not bad. And so again, I've been running with it, and so I'm very happy with HJet. And
Yeah, that's
so
great. Yeah,
yes.
and honestly, the results, like you said, underneath the eyes, right? And with fine lines and wrinkles, and just total facial rejuvenation have kind of been unmatched. There's some other products out there like Neogen that have been out for a very long time, that just were they haven't evolved, right? And AgeJet's a product that really the energy, the way it's dilated out there, the way that it's progressed out there is a little bit different from those products, and it allows you to do more things. So that's great. All right, jumping into the last part of the podcast, the last segment, which is where I really get to pick your brain about regenerative medicine and where it's going. Right, the future certainly looks much different. I can tell you, we have some products. I have some products that I'm working on right now, and bringing them into the U.S. and manufacturing coincidentally with some guys that are going to be completely, changing of the game. I would say changing of the guard almost, right? Of the devices that we're used to right now. So very similar to that. What is your take on regenerative medicine? That's out there, but now it's kind of become mainstream, right? So what are your thoughts on regenerative medicine and where it's going?
Absolutely. So I think that nowadays we understand more than ever the aging process. And so, especially like, like I'm telling you, I 50% of my practice is facial rejuvenation. Now we know why people look older. We know the anatomy behind it. We know the physiology behind it. And that's where I think regenerative medicine has made a big difference. Now, I use, again, whenever I do any type of facial rejuvenation case, I try to use autologous fat. To me, that's the product, or the I have access to the patient's own fat. And so, um, sometimes the adipocytes have stem cells, cytokines, all kinds of growth factors that have a potential regenerative capacity. And so, I usually microneedle it into the skin. Okay. I usually, do autologous fat transfer to the face. Um, and so, that's something that has helped me a lot. I And that's really, that's my main experience with with autologous products. I know that there's some other products that you can get, but to me, using the own, the patient's own tissue has been great. And so, as far as fat grafting, I turn the fat into millifat, microfat, and nanofat. And so, the way I think about it is, when I mention that the face is your skin, your wrinkles, your volume, and your structures. So volume is very important. And instead of going to the shelf and picking 10 syringes of hyaluronic acid, look, I have 20 cc's of autologous fat. So I use it for volume. I use it for to improve skin quality. And so, and I even use it for, for when you create nanofat, you can inject it directly into the fine wrinkles. And so, that has been also a very important component of my practice.
Sure. Yeah,
Um,
we've got obviously Revive our biologics line, right? We have age zero placental stem cell biologics, and they are remarkable with kind of what they're doing. And that kind of leads me into a question for you. You've heard of, these biologics, but you've heard of these peptides too, right? So what's your take on peptides and how they're being used, and where do you see them in the longevity medicine future?
I think, I'll tell you. I mean, I'm on diapers as far as peptides. We're just gonna start using them and offering them, but I'm telling you, this is something that is gonna explode in the next couple of years. I had patients tell me directly that they've tried different peptides. They work. My wife is a dietitian, a registered dietitian, and she specializes on weight loss. And so we realized that this is something that is taking off. So we're jumping on that ship, and we're going to start offering them. I think there is a lot of potential. Um, and so, thinking of, yes, we're plastic surgeons. Yes, you kind of want to see a before and after, but there's so much more things that we can do in order to help our patients, get the best possible outcome, get the best, um, the best health that we could potentially, help them to get. And so I think peptides are definitely here to stay. Definitely, maybe next year I can, share a little more of my experience.
Yeah.
But there's no question that regenerative medicine it's also a game changer. As I was mentioning earlier, I did reconstructive surgery for the first 5 years, and I use all kinds of biologics. There's no question that placental tissue, stem cells, um, is it, it, they work amazing. In cosmetic plastic surgery, I see a few more. These typically are very costly. So I haven't been able to really use them in a cosmetic setting, but that, that's, I'm a believer that whenever you can use a product to improve the outcome, absolutely is worth trying it. And so, like I said, we're just gonna start doing peptides. We're gonna getting into it because it's peptides, even of itself, it's its own,
Yeah,
its own topic.
game changer. So
Yes.
guys, if you're down in South Texas, if you're anywhere in Texas, please reach out to Ace Plastic Surgery, Dr. Cornejo's office. He's a guy. I mean, again, I talk about, some of these guys that are and gals that are coming up, right? And he's one of those guys that is really on the forefront of finding not only the best technologies and searching the world for them, but also you heard him, peptides, biologics, things that are making people sort of find that fountain of youth, right? So San Antonio and surrounding, go in and see my man, Dr. Cornejo. Dr. Cornejo, it was an absolute pleasure having you on the show, and
Thank you.
we'll definitely get you back on the show, later on in the year, just to hear your take on how kind of everything's evolved, because I know you're getting into a lot of stuff at Ace as well. So
Yes.
yeah,
Yes, Chris, thank you so much. And so, for our listeners, whoever's listening to this podcast, we do have our social media, Ace Plastic Surgery TX. We have our Instagram account, we have our TikTok account. And like I'd say, I'm very big on education. So I'm very, if you go into our website, I mean, our social media, I always like to just be informative. Okay, yeah, we do funny stuff and things like that, but I think technology is a key part of what we do. I'm very happy with you guys, with Revive, with Age Jet, with Retraction. I'll be more than happy to keep sharing our results. And thank you, Chris, for having me here and allowing me to just share my experience.
yeah,
I really
absolutely.
appreciate
Guys,
it.
below, I will tag Dr. Cornejo's Instagram so you guys can follow, like and share his before and afters, and all the great retraction and age jet posts that he has. But from surgery to podcast, the man does it all. So thank you, Dr. Cornejo. Appreciate you.
Thank you, Chris. Have a great day.